Hi, my name is Dr. Eric Schutz, commonly known as Dr. E. What I want to share with you today is a new extraction instrument I developed over the years called the Anglevator. There's quite a buzz out there about atraumatic extractions and all types of instruments and systems and theories on how to do them. From biomechanical rationale, physics forceps, twisting, power elevators, pulleys, levers. But we got to remember that we're not popping off bottle caps or pulling nails out of wood. We're extracting people's teeth. And let me say that any instrument will work under ideal conditions. But you and me know in dentistry, ideal conditions are very few and far between. So what I want is an instrument that works under any conditions. I've extracted teeth with periosteal elevators, periodontal probes, even elevated teeth with cotton pliers. But this only worked under those situations. Over the years, I was looking for an instrument that worked under any situation. The Anglevator can be used deep into the PDL like a PDL knife, sever the ligament, and then it can very easily be used as an elevator. So it cuts down on your instrument cut. It cuts down on your time. It causes less pressure on the patient, less pain, less stress for you. It makes extractions easier, faster. And the bottom line is, it makes you more productive. Because we know as doctors, time is money. I've extracted over 15,000 teeth, all unconscious patients. And what I've learned is that when you're deep down into the PDL, let's say with a periotome or a luxator or something like that, and you're down there and you can feel the advantage you have on that root. You have leverage, and it's just natural to want to twist, push, or just pop that tooth out. But the instruments break. The traditional way of an elevator that we learned in school is to come in from the side and work like that. The Anglevator, you position more apically and you work down into the PDL. So essentially it is working like a periotome, a PDL knife, very similar to a approximator. Then it has the strength to start luxating the tooth like a luxator, and because of the shortened blade and the thickened metal, it is able to elevate just like an elevator. So essentially you have 5 tools in one. It can cut the gingiva, it can sever the PDL like a approximator or a periotome, it can luxate the tooth like a luxator, it can trough out bone around root tips, making it an amazing root tip elevator, and it can elevate teeth just like an elevator. So you don't have to change instruments 2, 3, 4 times to extract a tooth.
Anglevator's sharp angle blades allow the instrument to cut more efficiently, penetrate deeper into the PDL, and engage the root surface more securely when elevating. The Anglevators come in a set of 3. 2 3mm Anglevators with a right and a left angle, and 1 5mm Anglevator. The ergonomic handle gives you fingertip control while navigating the PDL space and a tremendous amount of torque for elevation.
What's the biggest advantage of the Anglevator?
Well, the biggest advantage of the Anglevator is it makes extractions easier, less stressful on the doctor and the patient, less trauma to the patient, it's faster, and the bottom line is it makes you more productive.
Wow. Do you feel like a dental innovator?
I guess you could say that. It came by accident. It's something that's been very successful and very helpful to me over the years, and it's something I believe I had to share with my colleagues.